a little bit nervous because it's not love that's all around this morning, it's needles. But needles in the nicest way. Have you ever had acupuncture? If you have, tell me your story this morning. Some people still believe the whole business of acupuncture is a load of old hokum, but others firmly believe it's got some real health benefits. And now, I'm not sure if you're aware of this, you can get some conditions treated using acupuncture on the NHS. Well, next week is Acupuncture Awareness Week, so it's a good opportunity to find out more about it. So I'd love to hear from you. If you have been treated with acupuncture, did it work for you? Didn't it work for you? Tell me about your experience. Joining me in the studio this morning, Karen Charlesworth, who is an acupuncturist and a member of the York Acupuncture Network. Good morning.
Good morning,
Nice to see you. Alison Lane, who is, well, you're a fitness instructor.
I am.
And a recipient of acupuncture at some stage.
I am.
We'll hear in a moment about your experience of it. And Denise Magson, who is chair of the York Acupuncture Network. Good morning.
Good morning, Jonathan.
I didn't realise there were enough acupuncturists in York to require a network.
Absolutely. York's a little centre of acupuncture excellence. A lot of the students come to the college and then they train with us for 3 years doing degrees in acupuncture, and then obviously they go off to practice all over the country. But York has become a little centre of excellence for acupuncture.
Why is that? Why should York, of all places?
I think because of the kind of like the fact that we do have a college training the acupuncturists, so a lot of local people do come and train with us. And I think that the people of York as well are very responsive to having acupuncture because there's lots available.
Where does acupuncture stand these days on the scale of alternative therapies? Is it an alternative therapy still, or is it now moved so much towards the mainstream that it is now regarded? Well, obviously, if you can have some treatments on the NHS, it obviously is accepted. Karen?
Yeah, it's a really interesting question because I think generally we would prefer the term complementary because we feel that acupuncture works very, very well in combination with conventional medicine. So, you know, quite often a sort of a response from conventional medicine would be something like pharmacology or perhaps surgery. Acupuncture can be very good as alternatives, not in acute conditions perhaps so much, but for ongoing low-level chronic conditions. And as you say, there is now good enough research that acupuncture is accepted as part of a care pathway for about half a dozen conditions on the NHS.
Ali, tell me about your experience. As I say, you're a fitness instructor. Presumably, and you're a recipient of acupuncture. Tell me about your injury that you needed acupuncture to help with.
Well, I'd pulled the rotor cuff showing a class an exercise of a way not to do it and ended up being injured for 6 months.
Oh, dear.
And rather than waiting for physio and going to the doctors, I met Nikki Thomas at the yoga studio, and she sort of recommended a go with acupuncture. Being afraid of needles wasn't something I really wanted to do. I did it, and it worked immediately, and I was back in my job, being able to do the teaching position correctly without the pain.
How sceptical? I mean, setting aside your fear of needles, how sceptical were you that having some needles put into you could make any difference?
Well, at the time I did lay there thinking, I think this is a bit, strange. But actually, it was 2 days later that I actually realised I could get the full range of motion in the shoulder blade again, and it was amazing. But it did put me off having it done because I was scared of needles. I've now got over that, and I would definitely recommend it to anybody.
Yeah, it's a kill or cure when it comes to a fear of needles. And actually, the fear of needles is a strange thing because, like I say, I have experienced acupuncture before, and the needles that are used, if you're thinking of going to the hospital and maybe having to have a blood sample taken, and that experience, when they say, just a sharp prick now, it's not quite like that, is it?
No, you don't even actually feel it. You do feel like a little bit of a tingle and a kind of electric shock, but nothing that's painful. It's quite nice. It's quite relaxing, and I would definitely advise anybody with any sort of injury to go and have it done.
Well,
don't waste time.
It worked for you.
Yeah.
It worked for you. What is going on with acupuncture? Let's try and get down to the nitty-gritty of it. I'm not quite sure. I think Denise is nodding towards Karen to answer this one, because is it still a mystery as to why acupuncture works? I mean, it's a very ancient Oriental thing, isn't it?
It is, yes. It's between 3,000 and 2,000 years old, so we don't quite have the means of explaining it in a Western medical model. I mean, Western medicine would say that one thing that's going on is that when you put a needle in, it induces like a tiny local trauma, and the body sends extra resources to that area then to help it heal. And in the course of doing that, it will heal a lot of other things in that process. But that doesn't explain everything that goes on, because that's, if you think about it, that's quite a sort of muscular explanation. You know, it has to do with the muscles and the connective tissue and so on. But actually, you find all sorts of really wonderful side effects, which are very positive with acupuncture. So classically, you know, I treated a man just a few weeks ago for back pain, and he said to me in the course of his consultation they had a little bit of IBS, irritable bowel syndrome. The back pain is gone, and so has his IBS, which is, you know, a wonderful thing. Now, the Western medical model can't explain that. As acupuncturists, we have a very good Chinese explanation for that, which kind of sounds like, as you say, a lot of hokum, but actually is very real, physical, tangible effect.
And that is to do with energy levels and energy flows around the body, is it?
Yeah, it's to do with something that Chinese call qi, which you could loosely translate as your kind of vital energy. And when you put a needle in, the Chinese model says, what you're doing is accessing that qi and allowing it to flow more freely. So you're freeing up some bits of it that might be stuck in places, you're nourishing it where it's a little bit deficient in other places, and overall you're rebalancing the whole system.
Is it still an accepted thing in China? I mean, you say that it's been around for 1,000, 2,000 years.
That's right, yeah.
Presumably, you know, in this country people would go, well, maybe I'll give acupuncture a go. Or maybe if their GP says, actually, your condition is one of the conditions where we do now recommend acupuncture on the NHS, you'll go for it. But presumably for Chinese people, a trip down to the acupuncturist is as regular as us going to the dentist or the doctor.
Yeah, absolutely. And in China they actually have hospitals where they'll have a floor of conventional medicine and a floor of Chinese medicine. So, you know, typically you'll get somebody coming in with a fracture and they go in, they have perhaps an x-ray, they have the bone set, they'll have some plaster on, and then they'll travel up a floor and they'll have some acupuncture or some herbal medicine, Chinese herbal medicine, to help their system recover.
And nobody bats an eyelid?
Nobody bats an eyelid, no. It's totally integrated, totally accepted.
All right, we're going to take a brief break there. In a moment or two's time, I think, if I'm right, Karen is going to just pop one needle into my arm. Is that right?
That's right, if you're willing for that to happen.
Well, I've had acupuncture before, and I will say that it worked for me. It worked temporarily because I'd actually broken bones. Yeah. So what it was able to do was relieve pain where other things couldn't relieve pain. I eventually needed surgery, but the temporary relief I got as a result of acupuncture was quite miraculous. So we will we'll just have our little on-air experiment in a moment or two's time. I can smell... you've cleaned your hands with...
I have alcohol cleanser, yes,
alcohol cleanser. Right. So, stick around. After the next piece of music and after the traffic and travel news, we shall just experiment a little further. And Denise is going to tell us about a special acupuncture awareness week that's happening next week with acupuncturists touring York sports clubs and gyms to, well, maybe share the sort of experience that Alison has had as an acupuncture patient with other people. Yeah, coming up in a minute or two's time, we'll take a look at North Yorkshire's weather. Let's talk about the business of a sort of travelling roadshow as people get to be aware next week of acupuncture. Denise, just explain the idea. Are you sort of taking acupuncture out and about?
Yes, absolutely. So acupuncture, the profession of acupuncture is actually regulated by the British Acupuncture Council, and the members of the council locally around York got together to decide to really kind of collaborate to promote acupuncture this year, and there is a specific theme to the week, which is acupuncture to help people with sports injury. So we got to the idea of actually going out and about to meet people in the sports club to talk to them about how acupuncture can help them, maybe if they've had an injury, because obviously if you're a member of a sports club and you have an injury, you can be out of your sport for quite some time. So our idea was to create a roadshow to travel around all the different sports facilities in York and the area to really promote acupuncture and to let people know what it's like to have acupuncture, what it can help with, and just generally to raise awareness in the area about the fact there are a lot of acupuncturists in and around York, and we're all here to help people with sports injuries and a lot of other conditions too.
How challenged is acupuncture these days? As I say, I mean, it's become more and more mainstream of all the complementary therapies. See, I'm now using the right terminology.
Absolutely.
Of all the complementary therapies that are available, whereabouts is acupuncture now on the spectrum? Is it almost entirely accepted, or are there still plenty of sceptics about?
I'd like to think it was entirely accepted, but no, there are plenty of sceptics about, and really that's what Acupuncture Awareness Week is all about. It's about letting people know about acupuncture so that people are a little bit more aware of what it can do to help you and how it works. A lot of people are needle phobic, so one of the things with our roadshow is you will be able to try having an acupuncture needle. You can see how that works, and people can talk to you about it. So it's generally about raising awareness, and we had our first roadshow yesterday at York Sports Village, and it was really successful. And one of the wonderful things about that roadshow was there's actually quite a lot of children and parents coming in, and of course the children were quite interested and intrigued as to what we were doing. So it's kind of like creating awareness with young people about, you know, acupuncture, and that's the sort of thing that as a profession we really need to do.
Alison, when she was speaking earlier on, said that she quite quickly overcame her fear of needles. I mean, how bad was it? Were you the sort of person that wouldn't go anywhere near a doctor's appointment or a dental appointment that might involve a needle?
A blood test was put off a lot. I didn't like blood tests, so the thought of acupuncture with a needle was just, oh no. And to be fair, I didn't even feel the needles go in. And there was only quite a few times an odd one would feel like a little shock, but nothing at all.
My previous memory of having acupuncture needles put in was a tiny, tiny little sensation that something was happening, and then it was a feeling of almost like a numbness. I can remember as a kid kneeling on the carpet at home, and my dear mum had been doing some sewing, and I think she'd accidentally, obviously, left a pin on the floor, and I'd managed to sit on it. It wasn't painful. I just got like a numb feeling. I'm assuming this is how acupuncture was first discovered, actually. Somebody accidentally sat on a pin or a needle and realised it'd done some good. But I was suddenly reminded of that sensation, Karen, when I went for acupuncture on my back 25 years ago now.
And did you get the same numbness there?
I got the same numbness, and then I got a sort of warm, tingling feeling. Yes. Anyway, look, I'm putting off the inevitable here because Karen has moved round to my side of the controls. Just explain what you're doing now.
So what I have here, Jonathan, is an acupuncture needle. You can see that it's in a totally sealed, sterile blister pack. Yep. So every acupuncture needle gets used once and once only, and once it comes out of your body, I will put it into a sharp spin, and it'll be safely disposed of. So it's all totally hygienic, totally sterile. There are no risks to health at all from this. So what I'm going to do now is open this blister pack, take out the needle, and what I'm going to do is show you the needle, because then you can tell the listeners how fine it is. Because one of the things that we're finding as we go around with our roadshow is just, you know, people are quite needle phobic, as Ali's been describing. And I have to say, you know, I mean, I was quite needle phobic before I had acupuncture, so I really hated the idea of it. But you know, once you see them, it really does, you know, put you right on a lot of those fears. So
you can
see there, yes.
Hang on a minute.
So very, very small here.
Well, let's just so you know that when you go and look at our Facebook page, this is the actual moment.
This is the needle.
This is the needle. If you just move it a little to one side, we might actually be able to see it. There we are. Yeah, there we are. We can see it against the background of the studio.
So this needle is 0.22 of a millimetre thick, so it's absolutely tiny, about the width of human hair.
It is extremely fine. I don't know whether people will actually be able to see it on the photograph that I take. Anyway,
I've got some photographs that I can send you, which compare them to a paper clip, if that helps. Okay. So what I'm going to do now is put it back in its little plastic guide tube, and I'm going to come over to you.
Right.
The microphone travels with me.
Yeah, that's all right. Yeah. Okay. We'll do it like that.
All right.
Terribly technical, this.
It is. And I'm looking for this point on your elbow here. Once this is in, you should try not to move your arm too much.
Okay.
So I'm locating.
I've actually got to use those controls in a minute. Will that be all right?
What I'll do is I'll take it straight out again. So I'll just leave it in for a couple of seconds and then I'll take it out. So I'm looking here for the tendon of your biceps brachii and the lateral epicondyle of your humerus. Excuse my cold fingers. And there's my point between the two. Yeah. Straight in with the needle. Quick adjustment. And that's that.
It's astonishing. I mean, you really don't feel that go in. So there we are.
Great.
Just explain the construction of this, because we seem to have about ½ an inch or maybe a centimetre or less of steel, and then something else makes up the rest of the needle.
That's right. So the handle is made of a wound copper. You can get acupuncture needles in all sorts of shapes and compositions. So I'm just going to take this out now. Okay, so that you can use that on. There you go. So all kinds of materials. Some are silicone coated, which does reduce the sensation again. There's a bit of a debate in the profession about whether the sensation is a good thing or a bad thing. Lots of people say it's a good thing, they go looking for it. Other people, like myself, I think the needles do their work whether or not you can feel a sensation. So I'm quite a gentle needler. So how did your elbow feel now that the needles come out?
I mean, it feels fine. I mean, I would never know that it had happened. Why would you use that point? What as a treatment? Where, I mean, you might put a lot more needles in than that. I seem to remember when I had my back done years ago, I'd got them in a strip all the way down my back and all the way down my leg.
That's right.
But why would you be using that particular point you chose there?
Well, to be honest, I'm using that for you today because it's a point that will not be particularly active.
Right.
Normally, if you came to see me as a patient, I would do a very long consultation with you and I'd ask you a lot of questions which might not seem to be that related. But the great thing about acupuncture is it's a very holistic medicine, and by holistic I don't mean any kind of new age mumbo jumbo. What I mean is that it's basically you have this sort of 360-degree consultation which looks at every aspect of you and your health, and doing that is a fantastic luxury for me because it allows me to spot all kinds of things that allow me then to treat you as a whole person.
So this is back to the guy with the back problem and irritable bowel syndrome.
Exactly that, yes, absolutely. So we were able to work with the IBS as well as the back problem. So the reason that I chose this one today is that, you know, it's inert, it's easy to get to, so you don't have to take anything off for me to do it, which I'm sure you appreciate.
No, as I've said, the women around the studio and in the cubicle next door, they're very grateful about that.
That's right. So yes, it's just a good one for a quick demonstration so that people can see that acupuncture is not painful, you know, that the needles are very small, and it's a good, safe one to do without doing that whole consultation.
Okay, now I'm completely incapable of moving my arm to do anything else I must do the rest of the morning. No, I'm not.
That's not true.
No, I'm not. Listen, thank you so much indeed, everyone, for coming in this morning. Thank you for explaining things. The lasting effects for you, Ali, I mean, is it a case of, you know, you have acupuncture and then the benefits of it wear off very quickly, or was it something that stayed with you?
No, the effects wore off quickly, and touch wood, they haven't returned, and I'm still got the motion in the shoulder, and I'd still definitely recommend the acupuncture. And
then the next time that you feel the urge to say to a class, this is how not to do it, will you stop yourself before you get there?
I shall take the 5 kilo out of the hand first and show them without any equipment.
But at least it's cured you of A, the pain and your phobia of needles.
And I've been able to pass it on to quite a few of my participants. They've actually had successful results as well.
All right. And Denise, where and when are you appearing with your Acupuncture Roadshow? I said the sports clubs and gyms during Acupuncture Awareness Week.
Absolutely. So we'll be out and about at most of the majority sports facilities in York next week. On Monday we're at Fitness First. On Tuesday we're at Energize. On Wednesday we're in 2 places. We're at Poppleton Sports Club and we're at Dunnington Sports Club. On Thursday we're at York Sports Club on Shipton Road. On Friday we're all day at the David Lloyd. And on Saturdays we're out in Pocklington, the KP Club, and at Emperor's Gym. So if you're at any of those places, you'll see us. We're going to be very, very busy.
You are. You're going to get to people wherever they are. Listen, thank you all very much indeed for joining us this morning. Stay around, actually, because I can just see that we've had a number of calls, in fact quite a high number of calls, on the subject of acupuncture. So if you'd like to stick around and hear what people have to say and maybe give your own feedback, that would be great. And thank you very much indeed for all your feedback on the subject of acupuncture this morning. Ali has left us this morning, our person absolutely convinced that acupuncture did the trick for her, but Karen Charlesworth, acupuncturist and member of the York Acupuncture Network, has stayed with us, and so has Denise Morgan, who's current chair of the York Acupuncture Network, just to hear what you have to say and maybe respond to your comments on the subject of acupuncture this morning. Bruce is on the line from Pocklington. Good morning, Bruce.
Good morning, Jonathan.
Tell me about you.
I was in my mid-30s and I needed a hip replacement, and the consultant wouldn't do it because of my age. And then eventually he said I did, but he also said that due to the nature of the surgery, it would be possible that there was a chance I could get gangrene, and that I should stop.
You should stop what?
Smoking.
Aha, right.
And at that time I smoked about 30 a day.
Had you tried other techniques?
Well, you try to do it yourself, don't you? Just using your willpower, but it didn't work. Even though I wanted to, but you need something to push you over the edge.
At what point did acupuncture become a possibility to curb your habit?
Well, I'd read about it in the paper, and then there was a series of photographs in the Times showing you what your lungs were like, how long it took them to recover. And then another thing, a friend at work, he'd been to a place and had acupuncture, and he told me where it was, so I rang them up, made an appointment, went, had the treatment. I can't remember if it cost me £5 or £10.
It was a bargain by the sound of it if it worked.
And I've never smoked since.
Whereabouts did the needles go in? I mean, that's what...
In my ear.
In your ear?
And it was like an electronic needle. It wasn't a needle as such as the needle. It was an electronic instrument, had another point on it, and she did it in my ear, a couple of places in my ear, and then she put a stud in my ear and said to touch it if I felt the urge.
Give it a twiddle?
Yeah.
And how long have you been cigarette-free?
Well, I was about 38 when I had it done, and I'm now 75. So I think I've got my money's worth. I
think you just about have. You've had decades of it. Do you understand what happened? Do you understand why it worked, or just that it did work?
Well, it's something to do with the nerves in your ear, I believe, and how they work. But there was a byproduct from it, and that was I used to bite my fingernails. Not a lot, but I used to nibble at them, and I used to take sugar in my tea, and at the same time I stopped smoking, I stopped taking sugar, and I stopped biting my nails.
There's a thing. Gosh, you did get your money's worth in that go, didn't you? Bruce, thank you very much indeed for your call. Just explain, I mean, Karen, perhaps not surprisingly, and Denise are sitting here smiling and nodding. How much do people, I mean, we've talked so far this morning as if people are always coming to you with aches and pains and illnesses that they need treating. Here's an addiction.
Absolutely, and acupuncture is amazing for addictions. I think, as Bruce says, it's probably not going to, take you from 0 to 60 if you've not got the will to give up whatever it is that you're using. It's probably not going to do the whole job for you. But in the circumstances where you want to give up and you've made that decision and you just need that extra little push and a bit of support and some detox support as well, then, this particular protocol that Bruce is talking about, which is a protocol called NADA, which is available here in York for £5 at our community clinic just down the road.
NADA? As in Spanish for nothing?
Exactly that, yes. It does actually stand for something.
Right.
But yeah, if
nothing seems quite appropriate.
Yeah, entirely. Yeah, it is. So you can have that protocol, and that will really support you both in sort of quelling the cravings that you feel, but also then in detoxing, so as your body is withdrawing from whatever substance it is or whatever need it has to do something.
Let's hear from Nigel, who's on the line from Hustwaite. Morning, Nigel.
Morning to you.
You've had a similar experience to Bruce, I understand.
Yes.
Tell me about you.
Well, I was a smoker. I was a general practitioner who also gave anaesthetics. I knew that acupuncture worked back in 1962 when Felix Mann, who I think is the father of acupuncture in medicine in Britain, was curing patients that we couldn't cure on the wards. Anyway, I had a heart attack and I needed to stop smoking, and my darling wife from up here in York said, "One puff more on those, Chook, and I'm going away." I got myself, the physio who I worked with, who used to do acupuncture, was skiing, so I was really up a gum tree. Anyway, a girl came along with a box, and they were shining lasers on the acupoints, and it seemed to work, and so I bought one of those things that your previous talker, Bruce, was talking about, I got a little thing that gives you an electric shock, and used it in both ears and all the various places. There's also some places on the hand, and I never wanted to smoke again.
As a I mean, what will perhaps be quite powerful to people listening this morning is you are a trained medic.
More than that, I'm an anaesthetist as well.
So, what do you think is going on then with acupuncture? Because there are some people who are still sceptical.
Yeah, well, that's their tough luck, isn't it? If you give people a substance called nalorphine, which is an anti-opiate, acupuncture doesn't work. You can block it. It has to do something. It does evoke a stream of clean endorphins, which are different from those that nicotine evokes, and you do this for about a fortnight while you stop making the endorphins that the nicotine evoked, and the acupuncture brings you back to making your own proper endorphins.
How long did it take you to lose the craving for a cigarette?
About 24 hours.
Thank you very much indeed, Nigel. Not just a trained doctor, but a trained anaesthetist. So someone right at the sort of cutting edge of the profession when it comes to dealing with people's pain and managing all sorts of human systems when somebody is under anaesthetic. I think our next caller, Barbara, has actually got a question. Morning, Barbara.
Morning.
Hi. What is your question for our guest this morning, for Karen and for Denise?
Morning. Well, I was just wondering if this acupuncture, if, like, I've got a bad knee, I presume it's arthritis, very painful, but not painful enough for them to operate on me as yet. So I was just wondering, would it work on a dodgy knee, arthritic knee?
That's interesting, because I'm thinking really this is a bit like my back. Eventually, I had to go and have surgery because there was actually something wrong. If you've got arthritis, you have actually got decayed bones that are rubbing against one another, and given that it may have great powers, acupuncture doesn't repair decayed bones. So...
well, that's interesting.
Go on.
Yeah. Because there is some evidence to suggest that acupuncture can be beneficial for arthritis in terms of perhaps, I need to be careful what I say here, perhaps some reversal, but perhaps also some control of the symptoms that you get from that. What I do know, Barbara, and I can tell you without a shadow of a doubt, is that we have a lady who comes to our community clinic, and she has an arthritic knee, and when she comes in, she's hobbling quite a bit, and when she goes out, she's not exactly skipping, but she's certainly walking a lot more smoothly. She has a lot less pain. So acupuncture can really help in terms of both bringing down the pain levels, and also giving you back some more movement and some more function in whatever joint it is, really. And osteoarthritis of the knee is one of the conditions which the NHS does say that you can have acupuncture for, as paid for by the NHS, although that obviously differs from region to region. So I'm not quite sure if that's the case here in York, but you could certainly ask your GP about that.
Barbara, what do you think?
Oh, that's brilliant. Yes, I will. I'll make an appointment straight away.
Sold. By the sound of it. Let's go. I think our final caller is going to have to be Peter, who is on the line from Melbourne. Good morning, Peter.
Good morning, Jonathan.
Hi.
You're on good form again this morning.
What's your
I had a hard upbringing on a farm, and throwing heavy things about. And then I got smashed up with an anticoagulant when I was 1962. Then I went into building, and I ended up like you with a bad back. And I was actually being treated by the chiropractor. And after 4 or 5 sessions, they advised me to go and have acupuncture, which was the best thing. I'm very grateful to them.
Do you know what it's a very general thing to say, to have a bad back. Do you know what your actual back problem was?
Well, I'm 6'2", and you're always reaching down. I mean, everybody should bend down on their knees, as they know.
There you are, a great big lever, and you're using all the muscle groups in the wrong way.
Spraining it all the time, aren't you? And I was very phobic, really, from needles, because of having pneumonia when I was about 5 or 6. And so I actually went down to Fulford Cross and had a word with them. Sound very pleasant, nice young lady in there, and gave me the prices and everything, and I went back and sat in the car. And I thought, well, because I couldn't get out of the car when I went to the chiropractor, it used to take me 10 minutes. And I sat in the car and I thought, well, I'm going to have to bite the bullet. So I went back in and booked appointments right away, 6 courses. And it did the job. It was very good. I've had it since. I was looking forward to chemotherapy 2 years ago, and so I went to another place in Market Wheaton where we used to live, and got set up there as well. You don't feel the needles at all. It's quite surprising. And I mean, they are very fine, as you pointed out, and I would advocate it to anybody. If they're sat at home now listening to this, they want to get on off the backside and go and have it done.
You're sold, aren't you?
Absolutely. The best thing since sliced bread.
Thank you very much indeed, Peter. Good to hear from you. Mark has been in touch from Leeming Bar, who is also a complementary practitioner in his own right. He's the man that administers the Reiki therapy or treatment. He says he has acupuncture every other week. He had problems with his feet, and now he can actually feel his feet, which is which is quite a thing. Well, the feedback this morning has been terribly positive, which is good news for you, I suppose. As folks promoting acupuncture. There are those who will never be convinced, are there not?
Absolutely, yes. There are always people who won't believe it, or perhaps, haven't had a good experience. That does happen. But by and large, as a complementary therapy, it's a fantastic therapy for, working in conjunction with Western medicine, sorting out all kinds of chronic low-level problems that are, making people's lives a bit of a misery. So, nothing that's going to kill you, but lots and lots of things that are just taking the edge off your quality of life. Very, very good for those kinds of conditions.
Denise, have you still got your list there of places you're going to? Because we've had a number of requests from people to say, could you quickly run through it again?
Yes, absolutely. And if you look on our Facebook page as well, which is York Acupuncture Network, it'll tell you exactly where we're going to be. But we are going to be on Monday, we're going to be at Fitness First. On Tuesday, we're going to be at Energize. Wednesday, we're in two places. We're at Dunnington Sports Club and we're at Poppleton Sports Club. Thursday, we're going to be at York Sports on Chipton Road. Friday, we're going to be all day at the David Lloyd Sports Facility. And Saturday, again, we're going to be in two places. We're going to be Emperors, and we're also going to be out at Pocklington at the KP Club.
Right. There are needles out and about at the gyms and other places over the weekend. Thank you both very much indeed for joining us this morning. It's been an interesting discussion, and you've had lots of very, very positive feedback from Radio York listeners who've experienced the treatment that you give. Nice to see you both.
Thank you very much.
Thanks for joining us, and I hope next week goes well.
Thank you.